Mr. Andrew, he reiterates that the lockdown's got to work. Unfortunately, at the moment, it's simply not.
Well, the problem with Gladys Berejiklian's argument at the moment, Kieran, is she hasn't locked it down as hard as Melbourne, as much as she keeps trying to say that she has. You only need to look at the traffic on the road, what's open, etc., to see it is not as hard as the stage 4 lockdown in Melbourne. So she can say Delta is harder to contain. Unfortunately, even politically, she needs to go for a hard lockdown for at least 2 or 3 weeks to prove that's the case. And I think this is the view of Scott Morrison. He's pretty diplomatic when he answers your question here, but it seems pretty clear too that he wants the New South Wales government to get as close to zero as it can when that next phase opens up, when we've got 80% double dose vaccination around the country. Otherwise, he's pointing out or seeming to indicate there'll be problems even then.
Should Gladys Berejiklian lock down harder like Melbourne, or is she right when she says Delta is different, it can't be controlled?
I have always said very clearly that in the suppression phase, lockdowns have to work. Vaccines certainly support it, and Delta is like nothing else we've seen and is a complete game changer. But I want to stress something I said yesterday. To get to phase B, when we go into 70% of the country having been double dose vaccinated, the stronger we go into that phase, minimising the number of cases. You can't eliminate COVID. We all understand that, and no one's seeking to do that. That is not any government's policy in this country. But minimising those cases is going to ensure that we go into the next phase a lot stronger. You know, Australians have made great sacrifices to be able to get us into the position we have been in.
A real reminder at the moment for me about when Kieran and I were reporting at July last year about the Melbourne outbreak. The cases were rising in Victoria. It was inevitable then that Dan Andrews would have to go to stricter measures. He hesitated and he hesitated. It got to 700 cases a day and he did. I feel like I'm watching the same play in a different jurisdiction. Gladys Berejiklian question on this today.
What is it going to take? What are you waiting for to pull the trigger and further impose more restrictions, like a ring of steel, like a curfew? What is it going to take?
I think what we also have to accept is the basic fact that Delta is very different to other strains we've had. So policy positions that may have worked in the past aren't going to have effect with Delta. And that is something we need to accept. We need to accept this is a different variant and you need to approach it in different ways. And can I just finish my sentence on that one? So in relation to that point, based on the health expert advice, vaccination reduces your chance of spreading, it reduces your chance of landing in hospital, and it reduces your chance of dying. That's why a targeted approach in those local government areas with our vaccine strategy is absolutely key to seeing us maintain and reduce those case numbers.
The Premier said before that further restrictions won't work. The advice has come from you. Why won't they work? A ring of steel?
So look, I didn't take that from what the Premier had said, but the Premier... Oh, sorry. I didn't take that from what the Premier had said.
The direct word was they won't work.
No, I didn't. I'm sorry, this is a very important point. I was asked about specific actions and why they weren't taken, and I said very clearly that if we need to do more, of course we would, based on the health advice.
To me, that's pretty telling vision. There seems to be a little bit of a strain in that relationship, I think, between what Gladys Berejiklian is saying and what Kerry Chant is advising. We heard in the parliamentary committee hearings today that Berejiklian locked down initially when Chant said to do so. There wasn't any conflict there, but since I think there is, and you can see it here again too, when Gladys Berejiklian has been out there creating what appears to be false hope, spinning that at 50% of first doses she can lift some restrictions. If she does, they have to be minimal ones based on the health advice. Kerry Chant here saying you need 70% double dose to lift restrictions properly.
Certainly, I'm very committed to the issues around getting our vaccine coverage up, but very much recognise that we need that 70% before we have too much of a discussion about what easing restrictions look like. But obviously, there may be some ways in which, the community compliance can be strengthened with vaccine uptake.
70% double dose, you're looking at mid-October really at best. Have a look at the size of this outbreak. More than 5,000 cases now. Since 16th of June, 5,581